first Sjogren's patient receives stem cell therapy. The first person in the world to receive a dose of a novel cell therapy for a symptom of the immune disorder Sjogren's disease has been treated during a clinical trial conducted by researchers at the University of Wisconsin School of Medicine and Public Health. Bodily functions most take for granted, like the ability to cry or swallow, are a daily struggle for Julianne McGowan, the first research participant and patient in the trial. She suffers from xerostomia, or severe dry mouth, caused by Sjogren's disease, a disorder that affects moisture-producing glands in the eyes, mouth, and other parts of the body. The disease often accompanies other conditions like rheumatoid arthritis and lupus, but can occur alone. Julianne McGowan: early on, before I knew what it was, I'd drink an entire glass of water and still feel thirsty, thinking there was no amount of water I could drink to prevent being thirsty. In 2014, she started noticing other symptoms like joint pain, dry eye, and rapid weight loss, and learned her condition could be Sjogren's disease. In 2017, her diagnosis was confirmed by a medical professional. For people living with dry mouth due to Sjogren's disease, the daily routine involves keeping special lozenges on hand that help promote saliva production, as well as the constant companionship of a water bottle. Severe dry mouth limits the ability to eat and speak, and is a major cause of tooth decay, resulting in a dramatically reduced quality of life for many patients, according to Dr. Sara McCoy, Assistant Professor of Medicine, UW School of Medicine and Public Health and a rheumatologist at UW Health. McCoy is an expert in the care of Sjogren's disease patients and runs one of the few dedicated Sjogren's disease clinics in the Midwest. She also conducts clinical research to help improve treatment options for those who are facing the disease. McCoy noted that McGowan's dry mouth had worsened due to scarring of her salivary glands. There are no Food and Drug Administration approved treatments for Sjogren's disease, although multiple drugs are in Phase 2 or Phase 4 studies. Those drug candidates focus on active inflammation. None currently focus on the chronic damage that has already occurred in the salivary glands. Dr. Sara McCoy: for people like Julianne, there's nothing to help them, and I felt there has to be something we can do. McCoy wondered if the use of a patient's own enhanced stem cells could be used to improve salivary gland function in Sjogren's disease patients, and began working with PACT to start a clinical trial. She received FDA approval to initiate the trial in 2023. The approach extracts cells from the patient's own bone marrow, activates them, and injects them into salivary glands. Dr. Sara McCoy: the current standard of care is not addressing the root cause of dry mouth for these patients. With this cell therapy, we are hopeful we can do more than offer temporary relief, and give these people back these critical human functions. This Phase 0 trial is enrolling 6 patients and will be followed by a larger Phase 1 trial to establish safety and dose levels. Preliminary data on efficacy will be obtained in a cohort of 12 participants in an expansion phase of the study. The trial is open to people 18 and older with graft versus host disease, which also impacts saliva production or Sjogren's disease. Each participant will be given the therapy once, and the results will be tracked by McCoy's research team for about 2 years. While the goal of the first phase of the trial is to show that the therapy is safe, McGowan said she has noticed some improvement. Julianne McGowan: I had been taking several lozenges a day to help with my symptoms, but after the treatment I used them once or twice a week. Sjogren's disease impacts women more than men, about 8 to 1 according to McCoy, but there seems to be a lack of awareness of this condition, McGowan said. For this reason, she has found participation in the trial to be a meaningful opportunity to help spread the word about the difficulties Sjogren's patients experience, she said. Julianne McGowan: I want to increase awareness of the disease and what the symptoms are so others don't suffer.
Together we can shine a light on Sjogren's disease. Share to spread awareness.
Thank you for watching. Don't forget to like and subscribe to the channel for more research studies like these.